For the millions of Americans that have neck and back pain, many have been told that the only relief that they're going to experience is through pills and injections. But that doesn't have to be the case. That's what we're discussing today with our expert in neck and back pain, Dr. Christopher Miller, along with his patient, Martin. Thank you so much for joining us, gentlemen.
My pleasure. Thank you.
Yeah, Dr. Miller, this is an ongoing issue for so many Americans. Neck and back pain is a big, big problem.
It's huge in America, and unfortunately, Jordan, we have to meet with a lot of these patients that are struggling with those situations where it could be months or even years that they've struggled with neck or back pain, and a lot of them unfortunately just feel like they're on this never-ending circle that they just keep spinning around, where they're trying physical therapy. When that doesn't work, a lot of times they're suggested to start taking different medications, even forced many times to go to pain clinics and start getting injections into their neck or back. And the problem is, many times the conditions they struggle with aren't really being fixed by these treatments. It's just a way to temporarily mask the pain. And, they're just waiting for another hour to go by till they can take another pill, or another week to go by till they can get a shot. And they're struggling, and as time goes on, their spine continues to degenerate. Symptoms usually get worse, and it's just very frustrating for those patients, not only struggling with the pain, but just the fact that for many of them, never seems to be an end in sight, or never really any hope that the problem's ever going to go away.
Yeah, that's got to be so frustrating for all of these people when they're trying injections and they're looking for relief, but it's only masking the pain for a short time, a week, maybe 2 weeks, and then they're right back there in their doctor's office doing the exact same treatments. So you do something very, very different, but let's talk about some of the invasive procedures that people are doing now that really are just masking the problem, and why it's not working.
Well, first of all, just to start with medications, it could be painkillers, it could be muscle relaxants, it could be anti-inflammatories, but all these medications are just chemicals that circulate through our system, and yes, they can provide some relief with the pain, but they all do have side effects with those. And it's not the problem for most of these patients isn't that they don't have enough Norco in their system or a certain drug in their system. There's a condition that's happening that's causing their pain, and a lot of times when those drugs aren't really getting the relief they're looking for, they'll start doing the injections at pain clinics. Most of the time, Jordan, it's cortisone that they're injecting, and it's a strong anti-inflammatory steroid trying to reduce swelling and inflammation in the area, but they're not helping to get their spine healthier with that. In fact, some of the side effects with cortisone are advanced osteoporosis and a rotting of the bones. It can affect blood sugar levels, and we've had some patients that become diabetic after doing so many injections over the years. And when you don't feel the pain because it's being masked, you start doing more activities you're not used to doing, and you're just not feeling the pain, and you're actually wearing your spine down even quicker. And that's why a lot of these patients reach a point that structurally their spine is so degenerated, then the drugs or shots really aren't giving them any relief.
Yeah, it is just an ongoing cycle, and it's never ever getting better. So at Total Health Chiropractic, you're doing things a little bit different. I should say a lot different. So we have one of your patients here, Martin. Thank you again for joining us and sharing your story.
Okay.
Can you tell me a little bit about where you were health-wise and how you were feeling before you came to see Dr. Miller?
Well, I was very restricted. I couldn't drive long distances because of the pain in my legs. And my lower back was hurting really bad. It finally migrated up to my neck, going down to my left arm, and I had pain and tingling and numbness, and I would go through all three. And I was consuming bottles of Excederins and stuff about every 3 weeks. I was buying another bottle.
Wow.
And and then I went through the cortisone shots, and they were only temporary. And I'd go to work after the shots, and I almost felt like I was 20 years old again, and I was really going at it. And then the shot would wear off, and I'd have to go back. And then as time went on, the shots got less and less effective.
Just a repetitive cycle for you, it sounds. So when you finally came to Dr. Miller and you experienced the DRX, what happened next? How did you feel?
After the second time I was on the machine, the pain started going away. And by the end of the first week, the pain was completely gone in the legs and the lower back. And then after we finished that segment, we went further up, and we started on the neck one. And it took a little bit longer on that one because that one was probably the worst of my two. And by the time I finished up Friday, I just finished my last DRX.
Congratulations.
The pain is completely gone.
That's incredible. You've only been seeing Dr. Miller for about 6 weeks. Congratulations.
Yeah.
That is impressive. Okay, Dr. Miller, we do have Martin's x-ray up. Can you explain a little bit about what we're seeing?
So this x-ray is a side view of Martin's lower back. It's like he's facing the right. And what I put arrows on, the green arrow is showing a relatively healthy disc in his back where it's a bit thicker in height. And they would have moisture and hydration in there and almost act like a moist sponge. The red arrow, Jordan, is pointing to a severely degenerated disc in his lower back where it had thinned down to the point it was nearly bone on bone, caused horrible stenosis in his lower back, and that's what pinched that nerve, causing not only his back pain but his leg pain. And by doing our decompression treatment, we're able to help regenerate that disc and thicken that up. So, that pain is going away in his back and his leg because we're helping to get his back and his discs much healthier. So instead of being down in this area here, we're moving it towards more of a normal stage here where you can see the disc is very thick. There's plenty of space for that nerve, where when Martin started, it was more like this, where it was very thin and a lot of stenosis pinching that nerve. But he's getting these results because we're helping to regenerate these discs and get them healthier. This isn't just about masking the pain so he doesn't notice as much.
Yeah, instead of masking the pain, you're getting to the root of the problem with the DRX machine. Can you explain how this works?
Jordan, this is a medical device that non-invasively and naturally helps to regenerate these discs, and we can pinpoint the damaged disc level specifically. It's just a very gentle stretching. It's non-invasive. There's no drug shots or surgery involved. And another thing is you don't have to take time off from work and doing the things you want to do. That's one thing Martin brought up to me earlier, is getting those shots. Many times you're knocked out, you need people to help drive you there or take you home. Our patients are able to drive themselves and live their life as they go through this. But you can see on the animation, it helps draw those discs back in and thicken them. A lot of patients just take a nap or relax during the treatment. It's very comfortable for a lot of patients.
Yeah, and there are lasting results for the chronic neck and back pain.
Absolutely.
Without any injections, without having surgery. How are you feeling now?
I'm feeling really great.
Yeah.
Every day I wake up now, I don't stumble out of bed now. I just I jump right up and I'm going.
It's incredible. Yeah. Congratulations to you,
Thank
Martin.
you.
Okay, so if people are watching at home, Dr. Miller, and they're thinking, I think that he's speaking directly to me today. What do they need to do? Because I know you're offering a special.
Just stop waiting and call. Take that first step and call our office. We'll get you in and I'll meet with you one-on-one. We'll do a consultation and start taking these steps to get that problem fixed. We'll follow with an exam. We're also doing x-rays for $60 so that I can show these patients what's wrong with them and, like I said, start seeing if they're a candidate for decompression, if we can help them get as great results as Martin got.
Yeah, why not go in now before it gets cold and you really start experiencing even more pain?
Absolutely.
Thank you so much, gentlemen. We
Thank
appreciate
you.
it.
Thanks, Jordan.
Yeah. And don't go away. We've got more Eat West coming up after the short break.